Good morning, everyone. To those of you who are in United States, Latin America, Canada, good afternoon. To colleagues in Europe. End of June is a moment where we are observing multiple UN discussions about drug policy. It also is a moment where we are observing anniversary of the war on drugs in the United States, which is now 52 years ago. And so it is in this context that we are having a conversation with three representatives from New Jersey, Maine, and Maryland. They will be telling us about reports that they issued, which really sort of highlight the costs of the war on drugs in their own jurisdictions. As many of you know, I'm sure, today is also a day where UNODC is making available its global drug report. That report is a summary of sort of and a bird's eye view of what's happening in the world of drug policy across the globe. But we thought it's really important to take a much more local and focused look at what we are seeing at individual jurisdictions. And this year we're focusing on the United States and 3 states in the US. And so our speakers are Marlena Ubel, who is a policy analyst and state policy fellow, who researches the criminal legal system with focus on alternatives to policing that center on social justice. And I'm also delighted to say that Marlena, like me, is a trained social worker and brings social work values to her work. Megan Sway is a policy director at ACLU of Maine, where she advocates at the state and local level for policy change that focus on civil rights and liberties for all people in Maine. And Lawrence Grandpre is a director of research for Leaders of a Beautiful Struggle, the most amazing name of an organization I've ever heard. And he focuses on drug policy, criminal justice, police accountability, community-based economic education and development. So we will start with Marlena, and before we do, I also wanted to give a shout out to colleagues across the world who are participating in Support Don't Punish, an initiative that articulates the consequences of the war on drugs and brings community to the table to respond to them. So Marlena, over to you.
Thank you so much. Such a pleasure to be here with you all. My name is Marlena Ubel, and I am a state policy fellow with the Center on Budget and Policy Priorities out of DC, and I am a policy analyst full-time at New Jersey Policy Perspective. My pronouns are she, it, yeah. New Jersey Policy Perspective is what we like to call a think and do tank. And I want to talk a little bit about who New Jersey Policy Perspective is before I get into the specifics of the report, because we really think it's not just about the message, but it's also about the messenger and what our role is in the work. So, like I said, we are a think and do tank, which means not only do we do research, and we do rigorous research and analysis, but we also know how important it is to engage in advocacy. So my background as a social worker also really helps with this. Engaging people on the ground, talking to people with lived experience, but also talking to legislators, talking to the press, having a somewhat public presence. We use Twitter, we use TikTok. It's really important to us to make sure that the report is not just sitting on a shelf. And our target audience is usually advocates, lawmakers, and the press. Those are the people that we are mostly speaking to. And most importantly, we are a trusted source for policy analysis and recommendations in our state. And we have strong relationships with policymakers and their staff, reporters, and partners across the advocacy ecosystem. So that brings me a little bit to the report and who the author of that report is or was. Her name is Jenna Meller, and she's a co-director of the New Jersey Harm Reduction Coalition. So she is on the ground. Not only do they do their own research and policy analysis and advocacy, but they have firsthand experience giving out naloxone, running harm reduction centers, and really strong connections to the community and people who use drugs. So the report was written by Jenna in tandem with New Jersey Policy Perspective, and we did our rigorous research and analysis, but we also included those qualitative pieces. And that's also, I think, where my role as a social worker comes in. It is not standard that think tanks include qualitative data. And what I mean by qualitative data is, firsthand accounts, interviews, people that have really been on the street experiencing these things, their voices are included in the research. So we had some history so that people could trace the beginnings and ends and hopeful end of the drug war, and also the qualitative components, so that include people's voices, and we made sure to pay for their time because we want to make sure that we're doing this ethically. And then we measured the total costs of the drug war. So we have that quantitative data as well. And how we did that was we used arrest, prosecution, incarceration. We really tried to take into account how far-reaching the drug war is and what the costs of the drug war are in our state. What we found was we had a big takeaway was that it was cost $11.6 billion over a decade in the state of New Jersey to enforce the drug war. And that's roughly $1.2 billion a year. So pause here. Why does NJPP write reports? We do it to get attention, change narratives, and then ultimately change policy, because we understand that data, research, evidence, no matter how rigorous it is often not enough to change policy. You need to change narratives. Lawmakers are working in two spaces, and I have personally seen a lawmaker say, I think this is good policy, I agree with the research, but I don't think my constituents will like it. And so they vote no. And that's because it's really important to them that the public narrative supports what they're doing, and we understand that. So we use the findings that are grounded in facts and figures as a way to create framing and change narratives. So we make sure that our framing, as well as our data, is in the hands of press and lawmakers. So with this report in the release, we had a large press conference. We had more than 100 people from partner organizations. We had reporters from TV and radio stations. We had the state's biggest papers and most read political news sites. And we also ran some companion op-eds. So we had an op-ed that ran in the state's largest paper, and another op-ed with Cassandra from the Drug Policy Alliance, which is, I'm sure you're all aware, a national organization that has some reach, and lifting up the report's findings and recommendations. And we were successful. So all of the coverage included not only our big takeaway number, but our framing and our big policy recommendation, drug decriminalization. So I want to talk a little bit now about what the actual findings from the report were. So what we found was it was roughly over the course of that time, the 10 years, $5.1 billion to arrest, $2.2 billion to prosecute, and $4.3 billion to incarcerate. And this report had two major goals: give us a big number to wave around and get people's attention. Remember, that's the first thing, get attention. So we could have the space to talk about the drug war using our framing. and with our policy recommendations. And the second major goal of the report was to honor people who use drugs and to highlight their perspectives and experiences and how the drug war failed them. And they were collaborators every step of the way. We included them in the beginning. We handed out the report before we published it so people could read it and approve it. And we even included art in the press release that folks had made. That was really important to us. And because of that, it was more than a report. We brought people together, we built community, and built consensus. And this helped create a coalition to move decrim forward and push back against new drug war proposals. We have not decriminalized all drugs in New Jersey yet, but when we do, when, and not if, it will be because of the tireless advocacy and efforts of the organizations and individuals we brought together to write and release this report. And there is a gubernatorial campaign coming up, 2025, and the folks that are running are familiar with this report, are familiar with our framing, and they will be forced to take a position on the drug war. And I think that is success. So, thank you.
Thank you, Marlena. For folks who are wondering, how can they get a copy of the report? It is now in a comment section. Please take a look through it, and we will do the same with reports from Maine and Maryland. So, Megan, over to you. Thanks.
Thank you so much. Good morning. My name is Megan Sway, and I'm the policy director at the ACLU of Maine. We call ourselves the state's guardian of liberty, and I have been working on drug policy work since I started here at the ACLU about 7 years ago. But the ACLU has been involved in efforts to reduce and eliminate penalties for people who use drugs for many more years than that. Last year, we released a report together with the Maine Center for Economic Policy. It's called A Better Path for Maine, The Case for Decriminalizing Drugs. And this report brought together 3 different perspectives. I brought the legal and policy perspective. I've been a lawyer for 15 years now. With James Mile from the Maine Center for Economic Policy, he brought his economic expertise. And then the lead author was Winifred Tate, who's an anthropologist at Colby College and leads the Colby College Drug Policy Lab. Together, we wrote a report that tries to contextualize the war on people who use drugs in Maine. How did we go from sort of a state that was on the forefront of alcohol prohibition last century to a state that is on the forefront of pushing for decriminalization this century? As most social movements for progress are, there have been pendulum swings, and this report was an attempt to swing the pendulum in the way we wanted to go. So in 1976, Maine decriminalized the possession of personal use amounts of cannabis. But from there, we've then become one of the states with one of the highest deadly overdose rates in the country. As prohibition and criminalization progresses, each drug is criminalized, pushing people to seek other drugs and making the drug supply more deadly. So part of our report was walking through that process of how criminalization makes the drug supply more deadly. It also contextualizes why people use drugs, how this image that we have that people are using drugs, if you use drugs once, you are addicted forever and sort of dispensable by society is just completely untrue. And then we look at the costs, both the costs economically and socially to criminalizing people who use drugs. So Maine is a state of about 1.3 million people, but we spend at least $111 million a year criminalizing people who use drugs. We looked at the cost. A single drug arrest costs about just under $8,500. what else do we spend that much money on? That is 2/3 the cost of what we spend for a single kid's public school education. So we're spending as much on one drug arrest as almost we spend on an entire year of public school education for kids. That amount could buy 7 months of rent in the most expensive county in the state. And it could pay for several months of intensive outpatient treatment for someone with substance use disorder. Trying to look at this from different ways, what are ways that we could spend this money in a better way that would lead to healthier societies? We're in the midst of this pendulum swing. In 2019, we introduced a bill in the Maine legislature to decriminalize possession of under 3.5 grams of all drugs. That bill did not pass because then the COVID lockdown happened. But then we came back in 2021 and the House of Representatives passed a bill that would decriminalize drugs. We now have another bill that will be going forward in January, again to decriminalize drugs. So another thing we talk about at length in this report is not just the economic cost, but the social cost. We talk about how criminalization derails lives and can be deadly. We talk at length about how both, prohibition started as a racist project and the war on drugs as a racist project. And Maine is the oldest, whitest state in the country, and the people who are targeted and most harmed are still folks of color, especially Black people in Maine. We talk a lot about how this is a choice that state policymakers are making. This is a choice to invest in failed methods of social control instead of investing in things that help people lead healthier lives, that help interconnectedness, that build communities. We also talk about how the legal system is not built to address problematic drug use and can never be the solution we're looking for. As Maine has seen increased overdose death rates, there's been a real turn towards drug courts, towards a gentler approach to attempting to punish people out of drug use. And we go through in the report how that just is not something that is ever going to work on a scale that leads to a healthy state. And then finally, we end with what is the policy recommendation. And the policy recommendation, first and foremost, is to decriminalize drugs, but also to take the money that we are spending to punish people and reinvest it in ways that help people, that give people the foundation they need for community, for health, for connectedness. And that is what will lead us to reducing overdose deaths, to reducing this despair, to ending the cycle of keeping people in a permanent status, revolving in and out of the criminal legal system instead of staying in their community. So these are all messages in the report that we focus on, and we are using the report to speak to press, to lawmakers, but also to speak with our communities, to talk with folks. It's anecdotal, but in Maine, almost everyone has been touched by a fatal drug overdose. Almost all of us have loved people who have died, and we see an opening up of the conversation of what might it look like to not try to punish our way out of this. And we're using this report to try to bolster those arguments and to take a crack at that opening in people's hearts to look at ways that we could not focus on punishment, but instead focus on support. And so that is where we've really focused on the report, and we have taken it around the state. And we have our community partners, folks who are in recovery or who use drugs, have taken the report, and not only were they instrumental in informing the report and the data and the analysis that was in the report and the stories, but also they are taking the report and doing their own using it for their own purposes and talking about how this supports what they experience and what they want. And the recommendations were all based on recommendations that we got from folks who have been through the system and come out the other side in somewhere, none of them untouched, but all of them with ideas about how we could better approach substance use. And that's where I'll leave it.
Fantastic. Thank you, Megan. For those of you that joined us a little later, please make sure to take a look at the chat where you will find the link to the reports that we're discussing. And over to Lawrence to tell us about Maryland.
Good morning. My name is Lawrence Grand Prix. I'm Director of Research for Leaders of a Beautiful Struggle. We go by our initials LBS. We're a grassroots think tank out of Baltimore. We're not a nonprofit. We made a very intentional decision to not be a nonprofit based upon conversation with our elders in terms of the political energy of the 60s and 70s being co-opted in many ways by the professionalization of advocacy. So we operate from a very explicit community control, Black sovereignty, Black nationalist, Pan-African liberationist perspective. And we've been able to have some very concrete policy victories here in Maryland. We've been able to stop the construction of a youth jail. We overturned the Law Enforcement Officers' Bill of Rights, which gave cops immunity from internal discipline. And we just passed cannabis reparations, so the money from the war on drugs and legalization of cannabis will go to communities impacted by the war on drugs. So when OSF came to us to join the Decrim Advocacy Coalition, we said, no, that's not what we do. We choose for ourselves our own mechanisms of advocacy. And if people want to fund that, that's great, but we know what we got to do, and we do it whether people fund us or not. But I had conversations with folks, and I gave them what I call the standard narrative of decrim. You know, people cycle in and out of prisons, decreases their tolerance, overdoses spiking, toxic drug supply, arrest costs money, we'll reinvest the money once we decrim. They said cool, but they weren't really persuaded by it. This report is an attempt by myself and our research team to understand that, because it's not going to pass in Maryland until we understand that. Maryland's a 30% Black state, it's a Democratic trifecta. And under that Democratic trifecta, the percentage of Black folks incarcerated relative to white folks has increased to be one of the highest in the nation. We designed a research agenda designed to use qualitative research and analysis from our experience uniquely working with Black civil society, begin to interrogate the narratives around decrim, how people see the impact of the war on drugs in terms of the impacts on community. We talk a lot about individuals incarcerated, individual loss of freedom, individual deaths. Decrim advocates have not been great in talking about communal impacts, the communal sovereignty that's taken away, not just by the war on drugs, but also the nonprofit industrial complex taking away the ability for communities to define for themselves the mechanisms of liberation and services provision that they see as adequate for their community. So as a working class Black person in Baltimore, we've typically been the subjects of research and not the objects choosing how research happens. So we made a very intentional decision to flip that dynamic in this research project. I was a primary consultant. My co-author, Natalie Flace, and research assistant, Judith Parks, were at University of Maryland. So I basically designed a lot of the research proposal agenda, gave them research interview subjects, and helped them interpret the data, but they did a lot of the writing. I did the introduction, executive summary, and the postscript. And in that, we did around a literature review, an extensive literature review, examining how dominant academic literature talks about social capital in relation to people going through treatment services and addiction, trying to see if they had any theories for us to conceptualize what we wanted to focus on, which was the communal impacts of the war on drugs, and how to build community sovereignty through the provision of services. Long story short, there wasn't much there. So we relied heavily on our qualitative research to produce some theories about how to reframe drug decriminalization from an agenda more focused around community self-determination. So our findings were thus. In drug policy, there's a notion of freedom that many scholars, including Northwestern University Professor Charles Mills, calls negative freedom. You want the government to get off of your back, let you use drugs if you want to, not lock you up, et cetera, et cetera. This negative freedom was important, but was not nearly as important as a positive freedom to use the tools of governance to invest in communities to produce the institutions that better people's lives. Additionally, not only was drug decriminalization not inherently tied with producing positive freedom, the dominant institutions, the dominant narratives, the dominant theories tied to drug decriminalization, given the experiences of people in Baltimore, a cross-section of people who do addiction services, but also work with children, faith leaders, elders, an intentional, non-traditional cross-section outside of people who would just directly impacted by drugs through drug use, said that putting more money into nonprofit ecosystems not only does not inherently create community sovereignty, it can oftentimes decrease community sovereignty by forcing people to depend on institutions that are exogenous to community for the institutions they need to survive. And as opposed to building the community cohesion and community power, oftentimes that community cohesion and power is shredded by the very forms of investment many decrim advocates see as a solution to the negative community impacts of war on drugs. So the report includes many quotes. I don't have time to read all of them, but I do just want to read one. This is from a middle-aged Black woman who works in addiction services. I've worked in recovery homes, drug court programs, and in outpatient medication management programs everywhere. The truth of the matter is that it's driven by money. How much time is it going to take for someone to move through our treatment protocols so that we can say that we prove to the state that we are meeting our goals, we can prove we deserve more money than the university? How much money do we have to do things, to take clients into community, or to do things socially with clients? How much of the creation of alternative programming is going to take away from this primary programming that we feel is more efficacious than whatever the alternative programming is, and is more in line with the potential funding sources? The drive, of course, is more about how do we keep our jobs? How do we keep the money coming in? So this is an extension of a larger critique of our organization of the nonprofit industrial complex. We've taken many actions in Baltimore to have grassroots community control of funding, things like the Baltimore City Children and Youth Fund, things like the Community Restoration Fund. We're going to have a reparations commission in Baltimore to examine the impacts of war on drugs and to use the funding from state cannabis sales to go directly to local control so the individuals, the community can choose for themselves how to spend it. And it's because we have heard comments like this for decades. It's why we do what we do as 30-ish-year-old Black people, given the lessons from our elders, that given the nature of white supremacy in America, it's very difficult not just for conservative white racists, but also white liberals to invest Black people with a vision that they themselves have the ability to be their own solutions. There was a notion given to us from our interviewees that they have experienced relationships with funders, foundations, nonprofit policy advocates that view community as too broken, too traumatized to essentially be able to wield power for itself. And as long as that was the dominant conceptual framework, they would not trust that the money that would be saved through decrim would ever go to them. Additionally, they had a hard time believing that people who have historically operationalized these racist perspectives towards them could seriously operationalize a policy agenda to reverse the criminalization of Black people. So having a simple rhetorical commitment to reverse criminalization through the lens of arrest on drugs did not resonate because many of these people have been working on police accountability for years. And they say, well, I don't see the drug policy people there with me. Many of these people have been working for community control policing for years. And they say, well, I don't see the drug policy people there with me. So they don't seem to be so interested in criminalization as a whole. They seem interested in this very particular slice of criminalization relative to their policy areas. And also possibly they could get themselves money once decrim becomes a thing. So we operationalize these perspectives not just to critique drug decrim, but to really make the argument that in a state that's 30% Black, with the largest Black caucus in America, you are not going to pass decriminalization until you actually talk to grassroots Black community folks and give them a vision of investment and communal empowerment they can believe and buy into. We talk to not just lawmakers, but also people in community. They have what I call criminal justice reform fatigue. And to roughly define that, things like the Justice Reinvestment Act, which claimed to reinvest money in community, nowhere in America was that money actually reinvested in grassroots preventative services based upon academic analysis. So policymakers and people in community are saying things like, look, y'all keep talking about letting people out of jail. I get that that's what y'all want, but we're not in jail for drug possession for a long period of time. We're in jail for things like carrying guns because we have to sell drugs to feed our families, and y'all don't seem to want to talk about that because that's not a perfect victim. Similarly, y'all keep talking about getting people out of jail, and you're right. They spend less money incarcerating us, but we never see the reinvestment. They don't want to spend money on us at all for anything. So y'all just want to do the stuff which is acceptable, but never actually talk about going upstream in terms of investing in job creation, entrepreneurship, community institution building that will actually solve the root causes why people become addicted in the first place. And until you become interested in that, I may not have a lot of time for this decrim stuff because there's a political liability. We have a lot of conservative Black elders who remember Iran-Contra, the feeling that drugs were flooded into our community to disrupt the Black community, and therefore don't inherently see policy liberalization as a progressive measure, because they understand the ability for drugs to impact the community and disrupt the cohesion. Simply saying that that's not the intent and that's not going to happen does not deal with the decades of mistrust built up by Black community and Black civil society. So we're using the report to have conversations around these dynamics, using the report to have conversations within Black service providers to build up a liberatory movement for them to demand reinvestment. And then we want Decrim to plug into that. So as opposed to using the big flashy number on money saved to then rally people around that and hope the money gets reinvested, we're saying flip it. Build the investment in Black civil society, grassroots human social providers, and then have Decrim plug into that. That's how you get this passed in Maryland. Thank you.
Thank you all very much. Maryland report is now also in the Q&A section of your screen. Please take a look at the three of them. What I find incredibly inspiring from your presentations and also from the three reports is that it is about articulating policy needs from a community perspective. And I think that is what's incredibly important if we indeed want to drive change. Lawrence, I appreciate the points that you've made about Decrim being a tiny sliver of what in fact needs to happen in terms of responding to needs of your community. And I'm sure Megan and Marlena would very much agree that this is the case for folks living in New Jersey and in Maine. Again, I encourage everyone to please look at those reports. And there's, and this is not an accident that we are having this conversation today as the World Drug Report is being published, which is, again, incredibly focused on metrics that are not useful to people's lives. How many hectares of coca and what are the, how many tons of substances were seized and so on and so on. And all of those metrics really fail to show the reality that the three publications that you're talking about outlined very clearly, that we should really be focusing on quality of lives of people who are affected by either drug use or drug economy. And I think the three examples are quite inspiring in actually making that point. I wanted to read you a tweet from Volker Turk, who is the United Nations High Commissioner for Human Rights today, and ask for your response. New World Drug Report leaves no room for doubt. War on drugs harms, not helps public health. Fear and stigma drive people underground, away from services, and ultimately fuel tragic surge and drug use and drug deaths. And I think this articulation is something that resonates with us, because the sense that we have at OSF is that unless we actually get at a bigger public policy issue, we will be somewhat unsuccessful in addressing the needs of folks that actually are in need of assistance. As I mentioned earlier, Support Don't Punish is a campaign that a number of our colleagues across the world are tapping into to articulate their needs and grievances and asks. And so how do you hear that voice sitting in New Jersey, in Maryland, in Maine, from sort of the top of human rights structure at the UN? Marlena, I will start with you and move on to others.
Sure. Can you just ask that? Can I ask you to repeat the end part of that question? How these things are related? Is that the question?
So what we're hearing in response to the new Drug World Report from Volker Turk, the Commissioner on Human Rights, is that fear and stigma drive people underground, away from services, and ultimately fuel tragic surge in drug use and deaths. So how does that land? How does that very global statement from a human rights commissioner land for you in New Jersey?
Yes. Oh, absolutely. Fear, stigma, just misinformation about drugs and people who use drugs. That has fueled the conversation that is on the opposition for a long time. And we have, I should mention, New Jersey has the highest Black-white disparity in incarceration in the country. And we think of ourselves as a very progressive state. And these things are related because that fear and that stigma is used to demonize certain communities over other communities. And once you can take away a part of someone's humanity using that narrative, people feel very comfortable doing anything to them. So it's a huge problem. But I think that the report works really, really hard to change that narrative and to get rid of that stigma and to really humanize people in the state.
Thank you. Megan or Lawrence? Who do we call on next? Lawrence, go ahead.
So the impacts of public health from criminalization are substantial. I think we need to have a conversation about how exactly do we define public health, because I'm very interested in the health of the public. But being here in Baltimore, with institutions like Johns Hopkins being engines of things like gentrification that are actually public health negatives, there's a lot of concern that the focus on public health approaches to X equals socially just approaches to X has not been our experience at all here. And to the extent that drug policy is going to get buy-in from people on the ground, they're going to have to reckon with the technocratic, highly educated elitism of public health spaces and how they're trying to apply really important subject knowledge. It's really important when you're dealing with actual microorganisms and chemicals. Something like addiction, despite the disease model, has historically in the Black community been seen as a more holistic concept through things like historical trauma, through the slave trade, Jim Crow, police violence. These are things that don't fit neatly into a biomedical model when you start talking about spirituality and things that have been used by people in the community that use liberatory methodologies to address addiction for a long time. Think of someone like the leak and detox work done by the Black Panthers and the Young Lords in New York. They weren't just giving people acupuncture. They were giving them political engagement, which was seen itself as a curative malate that produced addiction. Those methodologies have not been always accepted in dominant mainstream public health spaces. We just have to talk about that.
Thank you, Lawrence. And Megan?
I think one of the things that comes to mind for me is that in Maine, there has been a big movement to talk about stigma and to talk about shame. And some of our top government officials say they want to address this. But one of the points we make in the report is that you will never get at shame and stigma so long as you make something illegal. That the illegality in and of itself is the state saying that this is wrong and bad and you should be put in a cage somewhere outside of society because you engage in this. And so, I also, the racialization of that shame and stigma and the class implications of that shame and stigma are all things that need to be unpacked in order for us to really get at this. And so I agree. And also, we have to be very bold in how we think about attacking that shame and stigma. Otherwise, it is just words that we're saying and we'll never actually get to the root of some of that.
So actually, there's a question here that I think follows quite well from all of your comments. What can we do as advocates to push the needle on on decriminalization legislation? And is a piecemeal approach the best we can do? Marlena, you said that we have not decriminalized drugs in New Jersey yet. That's also where I sit. So let me start with you, and we have 5 minutes left, so also use this as an opportunity for your closing comment.
Yeah, so this question speaks to my heart because I am personally, it's not necessarily the position of my organization, but I am personally an abolitionist. And so there's a lot of tension in advocacy spaces and community groups because we don't all agree. I think Lawrence really hit on this. Like, there are elders that are uncomfortable with the idea of decriminalization. And then there are also folks in the space that are uncomfortable with a piecemeal approach. They're like, all or nothing. I'm not okay with letting a few people out of jail while some other people have to stay. And as an advocate, as someone who is working in this space with law, almost on both sides, right? I'm talking to lawmakers, but I'm also speaking with the community. I think we've come to a place I have personally where sometimes I have to be okay with a piecemeal approach, because if it means that we can get, a few thousand people out of jail right now that don't have to wait until we can get it all, then I want to get them out of jail right now. And I understand that there are people that disagree with that as on principle, but that is where we stand. We will pull apart the system piece by piece if that's how we have to do it. And the front part of that question is what can advocates do? And I'll just say really quickly, and I think the other two panelists will have a lot to say on this. Just popular education, talk about this with people around you, talk about your family, your friends, just make sure that people understand, because I think one of the biggest issues that we face is that there is a lot of misinformation about drug policy, about people who use drugs, and about how we can better create a system that is equitable and just.
Thank you, Lawrence. Since you're shaking your head vigorously, I'll go over to you.
This is a debate we have a lot here in Baltimore, Maryland. If a reform you truly believe is a non-reformist reform that builds the space towards further advocacy, I would say go for it. I would say we have to be honest whether most reforms are that. The psychedelic decriminalization, given the whitening of psychedelics, really deal with the anti-Black reality that makes cocaine and heroin illegal. I would say no, and I would say you got to be careful, because once you pass something, the lawmakers are going to say, well, we already dealt with that. Come back in 5 years, simply evaluate the policy. There's a cost to these reforms. There's not just being Pollyannish and having purity politics to say, I want a bill that's worth passing. And it doesn't always mean you hold out for everything. I would say you talk to people in the community, actually listen to them, and I would say really build the bill around reparations for the war on drugs to mobilize people at the grassroots. That's going to bring people into your coalition to make more possible than you can. That is possible as a technocratic approach. When people say it can't be done, well, a lot of times they're saying this, I don't know how to do it. And I say, I agree. I do. That's what we've done here in Maryland. But you got to do different to achieve different. And the reality is, are you passing it because it's good? Or are you passing it to tell your funders you passed something? Just got to be honest about it.
Thank you. And Megan, over to you.
Yeah, I think one of the things that I think about is something that Lawrence mentioned is in order to get meaningful decriminalization, it has to be more than about drugs. We have to recognize the ways in which people are caged for things other than drugs. And if we work on multiple fronts, you are helping drug decriminalization as well as keeping people, getting people free on other fronts. So looking at everything from attacking we have drinking in public laws here in Maine. We have loitering laws where people are criminalized, looking at selling sex, like all of these things plug into drug decriminalization. And the way to work for me to chip away, but also to get lasting change, is to look at this as an interconnected web of ways in which people are being punished and are being controlled, and we will see the best results if we don't just look at this in a silo, but we are looking at it together.
Thank you. Last week, let me give a shout out to colleagues in Colombia. Last week, Colombia almost legalized cannabis, 4 votes short. And the report that was being used by the the people who are opposing cannabis regulation was from INCB, were quotes from INCB, the International Narcotic Control Board. And so I think it's really important to keep in mind that the sort of large that the large international drug policy regime is putting a lot of effort in making their arguments available to the world, and they're used by folks who are not reform oriented. That is why I was really appreciative of your institutions for taking up the opportunity to tell your reality, to tell reality of people on the ground in New Jersey, in Maryland, in Maine, because I think allowing our local legislators to rely on international documents to stop progress in our own jurisdictions is not a way to go. And so I want to just express appreciation to your institutions, to your collaborators that have put together those documents. I encourage everyone to please take a look at them, to use them as sort of potentially examples of how you may want to articulate your own realities. I also published a small piece today that I see is now in the chat. So please take a look at it. And again, colleagues across the world are gathering under the banner of support Don't Punish. And so it's fantastic to hear all of you articulate that framing for your own communities and your own jurisdictions. Thank you all for joining us. Thank you for making time to share your experiences. Happy June 26th as a way that supports reform and change rather than a day that is articulated as anti-drug, anti-people. It's our opportunity to reclaim it in a way that works for us and our communities. Thank you.
Thank you.